The ongoing struggle against cancer has spanned generations, marked by incremental progress and inspiring success stories, largely fueled by heightened awareness and advancement in technology. Emphasizing the crucial role of awareness, early detection and prompt treatment, the NSIA Youth Cancer Center underscores the importance of these factors in mitigating the profound impact of cancer on individuals, urging citizens to prioritize regular checkups and expedite treatment. The center advocates for the adoption of brachytherapy, a highly effective method that targets cancer cells directly while minimizing harm to healthy tissue. In a statement, the center urges citizens to be proactive in safeguarding their health, emphasizing the potential of brachytherapy as a powerful tool in the fight against cancer.
In the Themes Plus agenda of Mr. Governor Babajide Sanwo-Olu, health is the second pillar. And the plus in the Themes Plus is talking about social protection, which is what you were referring to, in terms of ensuring that even the vulnerable amongst us have access to social services, of which health is a fundamental part of that. With respect to the role of government in this regard, we have set up a social health insurance scheme. And one of the integral parts of that benefit package under the Ilera Eco Health Plan is cancer care. So currently, under our standard plan, we are able to cover cancer care for up to 1.5 million on the standard plan. And on the standard plus, you have coverage of up to 2.5. For the public servants, we also cover cancer care of up to 5 million for the public servants in Lagos State. We have a seniors plan, which not only has cover of 2.5 million, it also has wellness screening, which is to say you can go once a year to the diagnostic centers that we partner with to have yourself screened to ensure that you are cancer-free and you are still living a healthy life.
People struggling with their finances because they have cancer only happens in low and middle income countries like ours. That's not true. We have someone who is a doctor, so she's not somebody who is uneducated, or earning a low income, but she's a doctor, and she said, even when I had my husband who had cancer, the ripple effects of having that disease, it caused such a high financial burden that for over a decade she had challenges with her finances. So the challenge is that the reality is that it's a problem across the globe, except in places where they have very strong, healthcare systems where the patients are accessing care under insurance. There are some countries in the world where that is done. Cancer care is entirely free, but unfortunately the reality for a country like Nigeria is that that is not the case.
Our focus today is talking about financial toxicity, and we have identified that not only are women coming earlier than before, but a lot of them are still impeded by the fact that they can't afford the cost of care. So one way to actually reduce the cost of care is early prevention and early detection. It's far cheaper to treat at those stages, and cure is assured that when the disease is advanced, and then in an advanced disease you continue to treat for longer, and so it's going to be much more expensive and you cannot assure cure. So in that case, we are employing our women to go for screening. That's the primary prevention, and if anything is detected, come in early and then get treated.
Government are doing well. Already they furnished up to 6 centers in the 6th geopolitical zone of the country. But what more they need to do is to improve health insurance to cover this brachytherapy in the treatment of cancer patients, and indeed to cover all the different forms of treatment that we give to cancer patients, because cancer treatment is among the most expensive type of treatment in medicine.
At this point in time in this summit, we're focusing on how to improve access to brachytherapy care. The number of brachytherapy centers that are functional in the country is rather little. So those that are working and people who are getting access to the care are doing better in their cancer treatment than others. The summit is about helping us find out how we can actually improve access to it. And then, of course, we're talking about the cost implication of some of this treatment, which is really big for cancer patients who are going through the treatment for cancer.